Taking a look at your Health Watch. As families gather for the holidays, we want to highlight one of the most pressing public health challenges facing older adults and their loved ones. According to the Mayo Clinic, about 7 million people in the U.S. age 65 and older live with Alzheimer's disease. And to talk more about early signs of memory loss and what to be aware of, we have Dr. Lindsey Fish, of course, from Denver Health. So, Dr. Fish, explain to us exactly what Alzheimer's is and why this is such a growing concern. I feel like we're hearing about it more than ever.
Well, we really are. And so Alzheimer's is a progressive brain disease that affects memory, thinking, and behavior. And it really is the leading cause of dementia. 60 to 80% of dementia cases are a result of Alzheimer's. And as you mentioned, so many people are affected. It's actually 1 out of 9 adults over 65 has Alzheimer's, and that rate is increasing. And our population is increasing. So more and more people are in that over 65 group. And as you mentioned, we start seeing it more over the holidays as we get together with our families.
Right. You might not have seen grandma or seen Aunt Susie or anybody in a long time, so things might be a little bit different. So what are early signs that families can watch for?
So memory loss is what you hear about the most, right? Sort of forgetting things, not being able to follow conversations. That's really common. But we also should recognize things like suddenly grandma can't follow a recipe or do something that was really sort of straightforward or a simple task they were able to do previously. Getting lost in conversation is another sign. And the other thing to really think about is mood changes. If grandma used to be really happy and excited and now is kind of irritable or anxious, that can be another early sign.
Okay, interesting. I always just thought it was solely about the memory, but those are good things to look out for. So are there ways that we can help reduce that risk or slow the decline if we start to see these things?
So absolutely. Some of the stuff we talk about all the time, physical activity is so important at any age. But when we start thinking about patients who are in this over 65 category, it's really important to control their blood pressure, cholesterol, blood sugar. We know the body health affects the brain health. We want our older people to be really engaged, so have meaningful social relationships, getting together with families and friends, volunteering. Really important to stay mentally engaged. Puzzles, reading, games, some type of work can really help prevent this too. And then lastly, kind of throughout our lives, really important to sleep well, even as you get older, to make sure that we treat hearing loss in older patients and manage stress.
All right, so many things that we have to take care of for ourselves.
So many.
It is such a long checklist. So thank you. Those are great warning signs to look out for. And of course, we all will be getting together as well. So what support is out there for those that need it?
So at Denver Health, we're really proud. We can do memory evaluations. We have primary care and behavioral health services for both patients and their families. The Alzheimer's Association is a fantastic organization offering a 24/7 hotline, local support groups, and tons of resources. We know that planning and thinking about this early makes a big difference. So talking to your primary care doctor about what's normal aging versus signs of dementia, and really starting to make plans for both the patient and family, because it is a challenging diagnosis.
Yes, and it is a scary one too. It's something you might not want to admit to yourself, that these things are happening to one of your family members. So
absolutely
an important time to make sure you're aware of it. So thank you so much, Dr. Fish, as always, for being here. We'll see you next week.